This is an overview of anxiety disorders, a presentation from the Occupational Therapy Doctoral program at the University of Arkansas for Medical Sciences. This is presented by Kaylee, Sarah, and Sam, occupational therapy students. We begin by discussing specific phobias. So a phobia refers to a group of anxiety symptoms brought on by a certain object or by situations. So exposure to objects or situations brings an immediate reaction of intense anxiety, enough to cause the person to want to avoid the object or the situation entirely, and this can impact a person's ability to function. So adults with specific phobia recognize that the fear is excessive or unreasonable, but they're unable to overcome it. So there are 5 main categories of specific phobias. The first is animal phobia. So examples of this could be a fear of dogs, snakes, insects, mice. Animal phobias are the most common of specific phobias. There's also situational phobias, and this could involve a fear of flying or riding in a car or public transportation, going over bridges or into tunnels. There's also natural environment phobias, and so an example of this would be of storms, of heights, or of water. Blood injection injury phobias, and these involve fear of being injured, of seeing blood, or of surgical procedures. And then other phobias. So this is things like a fear of falling, a fear of loud sounds, or a fear of costume characters, such as clowns. So how would this affect my daily occupations? Let's take arachnophobia. So if you were afraid of spiders, this could affect your social participation in leisure and play activities like camping or gardening or doing things that involve outdoors where you could encounter a spider. ADLs, also known as activities of daily living, could be affected, like cleaning in dusty cabinets or sweeping underneath the couch. If you had a fear of spiders, you may not be able to do that. This could also affect your ability to sleep or rest. Imagine trying to sleep if you're having a lot of anxiety about a spider crawling into your bed.
Some interventions for specific phobias can include psychotherapy, which can include talk therapy with mental health professionals, exposure therapy, which focuses on changing your response to the object or situation that you fear. It can include gradual or repeated exposure to the source of your specific phobia and may help you learn to manage your anxiety. Cognitive behavioral therapy, or CBT, medications that can be used during initial treatment or used for the specific infrequent encountered situations, such as getting on an airplane or public speaking or going through MRI procedures. Beta blockers, and then sedatives, which can include benzodiazepines. Next, we're going to be talking to you a little bit about social anxiety disorder, which is a marked fear or anxiety about one or more types of social situations in which the individual is exposed to possible scrutiny by others. So what makes social anxiety different than regular anxiety? So it's more than shyness. It causes intense fear about social interactions driven by irrational worries about humiliation, such as saying something stupid or not knowing what to say. These individuals may not take part in conversations, contribute to class discussions, or offer their ideas and may become isolated. Panic attacks are a common reaction to anticipated or forced social interactions. These social interactions can include having a conversation, meeting unfamiliar people, being observed eating or drinking, and performing in front of others. The individual fears that he or she will act in a way or show anxiety symptoms that will be negatively evaluated, humiliating, embarrassing, or will lead to rejection or offend others. Some physical impacts, such as signs and symptoms, can include blushing, fast heartbeat, trembling, sweating, upset stomach or nausea, trouble catching your breath, dizziness or lightheadedness, muscle tension, and avoidance tendencies, such as speaking up in class or conversations, or using public restrooms when others are present, drinking or eating in public, or public performances. Some different interventions and treatments for social anxiety disorder can include psychotherapy in combination with medications. CBT, which is cognitive behavioral therapy, teaches you different ways of thinking, behaving, and reacting to situations that help you feel less anxious and fearful. In combination with healthy lifestyle, which can include enough sleep and exercise, eating a healthy diet, or turning to family and friends for support. And then as far as medications and pharmaceuticals go, anti-anxiety medications such as SSRIs or selective serotonin reuptake inhibitors such as paroxetine or Paxil or sertraline or Zoloft. SNRIs, serotonin norepinephrine reuptake inhibitors, including venlafaxine or Effexor XR, specific beta blockers, other antidepressants, or benzodiazepines. Some potential barriers to occupational performance can include, in adults, decreased well-being, employment, workplace productivity, socioeconomic status, and quality of life. Those with social anxiety disorder are also often single, unmarried, or divorced, not having children. This is more common in males than females. Older adults can interfere with caregiving duties and volunteer duties, as well as impeding on leisure activities. So, not being employed is a strong predictor that one has a social anxiety disorder. In children, this can lead to elevated rates of school dropout, crying, tantrums, freezing, clinging, or shrieking in social situations. And some occupational therapy interventions that can help with social anxiety can include establishment of routines and habits, some coping strategies, as well as promotion, prevention, or intensive or individualized interventions, which can include the promotion or participation in meaningful activities, as well as collaboration with teachers or those that they work with. And as an example, in a case study, a point of advocacy that we have, we're going to use me, for example, a 26-year-old OT student with social anxiety. So I have avoidance tendencies. I avoid speaking up in class for fear of being scrutinized by my peers or looked at like I'm stupid or treated like I'm stupid, or even being like feeling like my professors think I'm stupid. So what would help me would be to have that courage to be able to speak up, would be allowing my fellow peers and students to have grace with me and understand I may not have all the answers, I may not have all the correct answers. Don't call me stupid, don't look at me like I'm stupid. What doesn't help is telling me it's going to be okay, telling me like don't worry about it, like don't stress over it. That's not helpful to anyone with anxiety, period. And then different opportunities for success for me would be having those safe conversations with those I trust, and being able to speak up and offer my opinions in class, again, like in a safe situation.
So I'm going to be discussing panic disorder. So panic disorder occurs when you experience recurring, unexpected panic attacks. And the DSM-5 defines a panic attack as an abrupt surge of intense fear or discomfort that peaks within minutes. So people with this disorder live in fear of having a panic attack. Most people experience a panic attack once or twice in their lives, but panic disorder is characterized by a persistent fear of having another panic attack after you experienced at least a month or more of persistent concern or worry about additional panic attacks or their effects and consequences on your life. So some symptoms of panic attacks include racing heartbeat, palpitations, shortness of breath, feeling like you're choking, dizziness, lightheadedness, nausea, sweating and chills, shaking and trembling, changes in your mental state like a feeling of derealization where you feel detached from reality, or depersonalization where you feel detached from yourself, numbness or tingling in your hands and feet, chest pain or tightness, or a fear that you might die. So you'll want to see a doctor if you're having panic attack symptoms, because panic attacks, they are uncomfortable, but they're not really dangerous, but they're hard to manage on your own, and they might get worse without treatment, and the symptoms could resemble symptoms of other serious health conditions like a heart attack. Your PCP or primary care doctor might do some tests to look for a panic disorder. Your psychiatric provider could do the same. They might look at some blood work to make sure that these symptoms aren't related to another disease process like a heart attack. They could also use the DSM-5 criteria for diagnosis, and for panic disorder, that would include frequent unexpected panic attacks, ongoing worry about having another panic attack, fear of losing control, and no other cause of the panic attack, like a physical disorder or drug use. And so treatment could look like a psychiatrist, a medical doctor who specializes in mental health that can prescribe medication, a psychologist, a professional that's trained in psychology that could provide counseling, a licensed clinical social worker who could also provide counseling and then could not prescribe medication but could work with providers that could as part of your treatment team. And occupational therapy would be a great fit for someone with a panic disorder. Occupational therapy works to establish healthy habits and routines They work to increase self-esteem by increasing self-efficacy, your ability to participate in things that are meaningful to you, to break down barriers that are getting in your way. Prevention strategies for clients, looking for preventing triggers for panic attacks. Occupational therapy is very client-centered, so there is no one-fits-all treatment plan. And environmental modifications, or what we call a sensory diet. Everyone has sensory preferences, sounds, sights, and feelings that you prefer or things that you would like to avoid. So we would work with a client on creating an environment that could be conducive to decreasing stress and anxiety. As far as medication management, both SSRIs and SNRIs, selective serotonin reuptake inhibitors, and serotonin and norepinephrine reuptake inhibitors, including drugs like Prozac, Paxil, and Zoloft, and Effexor, are both approved by the FDA for treatment of panic disorders and have a lower risk of serious side effects. Benzodiazepines are also used, but they are generally only used on a short-term basis because they can be habit-forming and cause physical and mental dependence. Also, they're not a good choice if you've had problems with alcohol or drug addiction in the past because they can be habit-forming. They can also interact with other drugs and cause dangerous side effects. My case study, I used myself. I am a mother of these 3 little children. I am a nurse, as you see in the photo. I am married, and I am a graduate student. So if I had a panic disorder, this could affect me as a mother because I may be less likely to take my children to engage in activities that could trigger anxiety to me, or I may worry that I might have a panic attack in a public place, embarrass myself, or endanger my children, especially if I'm the only parent there. I may have trouble with panic attacks in my job as a nurse. I can have high stress situations, trying to take care of patients or save a life. I may worry that I might endanger the life of my patient or endanger my license by a panic attack. This may cause me not to practice in nursing at all, or at least change the field that I'm working in, and it may be something that is less fulfilling for me. As a wife, if I'm worried that panic attacks may rule my life, I may worry that my spouse will become annoyed with me or put off, or that I might be putting more work or pressure as I'm unable to take care of the things that I want and need to do as a wife. As a graduate student, we have high pressure situations. We have tests, we have one-on-one examinations of our skills where we demonstrate skills to professors. If I have a panic attack, I would be unable to complete these skills, and I could fail an exam or fail a class or fail out of the program. I may decide that I'm not able to sustain myself in a program if panic attacks are going to disrupt my life. And this is a good place for advocacy, for education, and for support systems. There's free counseling at my university, so if I'm able to go to this talk therapy, this could be something that could help me. And if not, or even with talk therapy, I could use medication to help. There are some similarities between a panic disorder and the specific phobias. And one that has a lot of crossover could be a specific phobia of agoraphobia, or the fear of going outside or being in places. People with agoraphobia have a fear of losing control in public, just like a panic disorder. They have a potential feeling of detachment from others, just like a panic disorder can have. They might feel helpless. They might feel like their body or their environment is not real, just like the detachment experienced in panic disorder. And they also rarely leave home, which is something that could occur if you're worried about having panic attacks in public places. So this could also be similar to social anxiety, because you could see how being around people in new environments would be stressful and a frightening experience that could lead to a panic attack. So this is similar to generalized anxiety in that it does include anxiety, but generalized anxiety is typically a lower level of anxiety that does not result in panic attacks or a thought process that is worried constantly about panic attacks.
My name is Sam Holloway, and I'm going to discuss generalized anxiety disorder. Generalized anxiety disorder is a condition in which individuals exhibit persistent and excessive worry over a vast variety of things, including money, health, family, work, school, etc. GAD affects 6.8 million Americans, or 3.1% of the U.S. population. Studies have shown that women are twice as likely to have GAD than men. The highest prevalence of generalized anxiety disorder lies within the age ranges of childhood to middle-aged. It is commonly observed that the individuals with GAD understand that their anxiety and reactions are stronger and unnecessary for what the situation warrants. Though they understand this, they are unable to control their reactions. As for what causes this disorder, there is no known exact cause. However, there is evidence that biological factors, familial background, and life experiences, particularly stressful ones, may cause GAD. So, what does generalized anxiety disorder look like in adults? Here's a list of some physical and mental effects that are commonly seen. In children, since GAD is commonly seen and described through an educational point of view, since this is primarily their main occupation, these are symptoms that are commonly seen. So how is GAD treated? GAD is treated through various methods, the most common being therapy and medications. Psychotherapy for GAD can include individualized therapy, group therapy, family therapy. Cognitive behavioral therapy is also a common treatment for this condition, and it allows the therapist to teach their patients how to change their behavior within certain situations, as well as learning new ways to regulate their emotions. Common medications used to treat GAD are SSRIs, SNRIs, other serotonergic medication, and benzodiazepines. GAD impacts various occupations throughout individuals' lives, including their ADLs, by fatiguing the individuals to the point where they are unable to take care of themselves, preventing them from falling asleep or staying asleep, and many with GAD find it difficult to develop and maintain an appetite due to their emotional state. IADLs are impacted as well, as these involve an avoidance of shopping or other errands, and inability to properly manage their finances, as well as home maintenance and management. Individuals with GAD experience difficulties with work by finding or maintaining a job due to an avoidance of stressful situations, which could be daily duties of work or interviews. Social participation is impacted as individuals with GAD are unable to effectively keep and maintain friendships due to a lack of control of situations, as well as an avoidance to potentially stressful or triggering situations they may be invited to. OT can help with GAD through various methods, but three commonly seen ones are the implementation of relaxation strategies, the development of coping strategies, as well as teaching their clients self-awareness skills. These strategies are able to help clients gain control on their anxiety and begin to manage their reactions and emotions to triggers. So after hearing all about the different types of anxiety disorders, I bet you already have an idea of how they may differ from GAD. According to the DSM-5, GAD presents itself through difficulty concentrating, irritability, and restlessness, whereas panic disorders may cause feelings of detachment from oneself, feelings of losing control, or fears of dying. Social anxiety shows very similar manifestations to GAD. However, a key difference in social anxiety is often concerning meeting new people, being observed, being evaluated, performing in front of others. Thoughts typically revolve around negative evaluation or being rejected. Physically, GAD and social anxiety are very similar through increased heart rate, dizziness, muscle tension. Panic disorders share many physical manifestations. However, there are differing symptoms that go beyond what occurs in GAD. These symptoms include heart palpitations, pounding heart, accelerated heart rate, excessive sweating, shortness of breath, difficulty breathing, chest pain, nausea, abdominal stress, feeling dizzy, unsteadiness, feelings of being lightheaded or fainting, numbness, chills, and hot flashes. So let's look at a case study in which I'm using myself as the example. I suffer from generalized anxiety disorder and want to explain how GAD has affected my life as a grad student. What would GAD look like in a 27-year-old OT student? GAD may prevent me from being confident in my responses, preventing me from speaking up in class, thereby not allowing me to receive participation points. GAD may prevent me from sleeping due to the fact that I'm worried about assignments, tests, group projects. Ultimately, a lack of sleep may prevent me from engaging in class activities to the best of my ability, which may result in poor grades. GAD may make me irritable to my family and friends, which may affect my social life outside of school, preventing me from having an outlet to get me away from the stress brought on by grad school. My partners and I thank you and appreciate you listening to our presentation over anxiety and the many different disorders that are included. Here are our references. Thank you.